healthcare, I didn't use it as a slide, is you have a good idea, and if you want to start it, you need money. And in healthcare, people say, well, you need to prove that it works, and then I will give you money. But to prove that it works, you need to implement it. So if I can make one recommendation to all of you, is to make sure you have a small pilot grant. Just a small, start small, think big, act fast. So this is the way we operate. We got a small starting grant. We started in a small region, Nijmegen, with just physiotherapists. Now we have a national network with 1,600 people. That's the way to move forward, but you need that starting grant, that's crucial.
But is money the only condition, or the most important condition, decisive condition?
Sorry? Which
is money the decisive condition?
No, there are several requirements. I think you need a starting grant. Obviously you need a good idea, which takes the customer as the starting point and not us. And that often goes wrong. You need to actively involve patients, TIFCAPs in the process. You need a wonderful team, which is crucial. And I think the reason ParkinsonNet was successful, and that's why I said I was a crucial factor. I'm a physician. I see patients every week. As we say in Dutch, I'm in the clay up to my knees. I work in the medical world. And that's why innovations driven by a physician, I think, are still more widely accepted compared to, say, Microsoft, who comes up with a wonderful solution. So I think it's important to involve people from the field.
There's one question here.
Thanks once again for a wonderful presentation. In the beginning you had to quote that we all want to innovate, but we don't want to change. You illustrated quite nicely how patients, TIFCAP, are changing. I don't know if they know already. But the other dimension is the care providers. Yeah. You're very motivated, but how can you, do you have a recipe how the care providers are willing to change within this model? And it's only a subtle element, but payment is very important for them. So I think to have a sustainable model, it's very important to have a funding model which is supporting this kind of care delivery.
Yeah. No, I think it's a very important remark. I think there are a couple of reasons why you can provide or persuade the professionals to change. One is, I do feel that most people working in the healthcare system do this with the right motivation. So the system makes it impossible to do what we would like to do, why we chose this profession. So if you facilitate them in working more patient-centered, most people will eventually change. So that's one factor. The second factor is that I think and hope that patients themselves will be the driving factor behind changes in healthcare. If we now visualize where the expertise is, patients are now actively choosing for ParkinsonNet professionals. So I do get complaints about people who are not in ParkinsonNet because they see their clientele dry up. So the patients are, if it's a Dutch expression, they vote with their feet. So the patients become the driving factor behind innovations. But the third, I think, is money. We are now in active negotiations with the health insurance companies that ParkinsonNet professionals get an A tariff, whereas the non-ParkinsonNet professionals get the B tariff, which also makes it financially unattractive to start delivering care for Parkinson patients. The only disadvantage is that always when money is involved, people start to become a little bit weary. So I think it's the third option right now, and it's also the last approach that we've taken so far. And it's still not really, as you know, we're still working on this.
Hi, Bas. You're my neighbor, so I can...
Yeah.
Okay. Thank you very much for this great presentation. I have basically two questions. First of all, this congress goes to Stanford next September.
Can I go?
You can go if you explain to us which other communities you've built.
Yeah.
Within the framework of Maastricht. So I'm very curious what the strategy would be. You're not being maybe a specialist in other fields, but you're a specialist in Parkinson. How will Maastricht grow, and what can we all do in a 2.0 way to help you with that? That's the first question. Second question is, in Parkinson's, you covered the Netherlands. What's the next step? Will it be Europe? Will it be Belgium? Will it be the world?
Okay, my secret dream. I think the first question is a crucial one, and it would actually be nice to have the debate with all of us here, maybe, or afterwards. I think new communities, the driving factor still is through the health professionals. And Jan Kramer, my close companion and friend with whom I started this initiative, we both feel that this is the way to move forward. We had, for example, an advertisement in the Telegraaf and nothing happens. I think the Nationale Patiëntendagen and the failure of the Nationale Patiëntendagen, where nobody showed up, is an illustration that patients are not naturally have no inclination to liaise. So if you persuade a leader in, say, diabetes, COPD, as the community manager, as the front person, that's the way to move forward, and he makes other people enthusiastic. So that's our strategy, to build new communities. And in terms of ParkinsonNet, what is interesting, ParkinsonNet Oregon has just been founded, so that's in the United States, not far from Stanford actually. There's great interest from Germany, and it's easy to copy the concept. The only problem is if you go, for example, to Australia, you need a certain density of people, because a side effect of selecting people is you need to travel further. And of course it depends on how sick you are, how far you want to travel. If you have a deadly condition, you want to travel to the other side of the world. But for a grown-in toenail, you don't want to travel more than 15 minutes. So that's a difficulty in other countries. So I think telemedicine, and I think we will hear more in the session today, is a solution for those countries.
Well, thank you very much. Thank you again, Bas, for your